Hi there. Thank you guys for coming to Wild Med Wednesday. We are super excited to have Dr. Kurt Eifling with us tonight. He attended medical school at the Northwestern University and then entered as an active duty in the U.S. Navy. After an internal medicine internship, he spent 3 years as a general medicine medical officer with the U.S. Marine Corps Infantry, serving 2 combat deployments to Afghanistan. He re-entered civilian life, completed a residency in emergency medicine at Washington University in St. Louis, and then a fellowship in wilderness and environmental medicine at University of Colorado. Drawing on over 2 years of experience running medical operations within field camps in locations ranging from Sri Lanka to Greenland, his current work projects work to ensure wellness in archaeological field research sites and addressing the mental health difficulties of deployments and returning home. He resides in Fayetteville, Arkansas with his wife and his 2 boys. He works as an emergency medical physician, currently affiliated with the University of Arkansas for Medical Sciences, and serves as a medical director for the Ozark Off-Road Cyclists and Mountain Bike Patrol. So welcome, Dr. Kurt Eifling. We're so excited to have you.
Thank you. Thank you for having me. I'm going to go ahead and share my screen, but I appreciate everybody being here. I was approached last summer at the Wilderness Medical Society summer meeting in Colorado about presenting for this group, and just as we were kind of talking before everybody else came in the room, I learned what PAs are and sort of what they're for during my time in the Navy. And I have a ton of respect for the skill set that you guys are gaining and that you're going to put into the care space. So I appreciate you guys and glad to be a part of this. Glad to be a part of the effort. So what we're presenting here tonight is mostly a rehash of a workshop that we presented last summer, which was one of the first in-person conferences within the Wilderness Medical Society after coming off of COVID. And it was kind of a strange experience for everybody. The theme of the conference for the summer, Taylor Hatton, one of the other wilderness medicine fellows, she's at Medical College of Georgia. She had really struggled with a lot of things during COVID that I think a lot of us did. And she decided to theme this conference that she was in charge of coordinating kind of after that. And so when my old partner from University of Colorado, Laura McGladry, and I kind of put a couple of these things out there, she really kind of pulled to have us in there. So this workshop was part of that content. So I've made a couple of modifications, and just also having lived since last summer, the same as all of you, coming out of COVID a little bit further and trying to figure out which things were strange because of COVID and in what ways did we all kind of become weird because of that kind of cultural, emotional injury that I think everybody had, which things have returned to normal, which things haven't. So we'll talk about that a little bit as well. But this content was originally scheduled as a 75-minute workshop there at the conference, and I've still never given it in its real form or the form in which I designed it, because the last time we gave it last July, we tried to go around the room. You know, we kind of had a packed kind of side room at the conference, and just ask everybody to go around, say, who are you, where are you from, kind of what brought you here, and we'll you know, kind of get everybody's names in the room and then move on. The first 3 people all kind of were a little bit longer than I thought they would be, so I kind of tried to redirect everybody. Hey, just, you know, we'll try to be short and kind of get through everything. The next people went long, and then 40 minutes later into the 75-minute workshop, we had finally made it through the whole room. Couple of people had kind of broken down crying, and a couple of people really were confused by kind of where they were and what they were doing, and they were kind of happy in their jobs and didn't know what was going on. But it was clear that there was a broad and really deep kind of range of experiences that people had had with this, and different types of injuries that people were expressing in that space. So it was a lot. So this time I will not be asking everybody to go around and introduce themselves, but there will be some space for discussion later on in the session. So we'll kind of get through the core content, and then what I'm really curious to learn is, well, I'm excited to share kind of the ways that my own tilt towards this has matured in the last year, and to hear from you all who are kind of on the training end of the stick here, how the presentation of this, either here or within other modules of yours, has matured since I was going through, and since the last audience that I met with. So I'm really interested in what you guys know and what you see. So the first thing that we really wanted to bring up here was brace for a paper. We'd been going through a lot of the literature trying to find something that was readable, something that was meaningful, because there were a lot of sort of lay press things. It was hard to find just a readable baseline bit of knowledge to have about sort of what this is, without a lot of spin as well, and we'll get to that. Second is a little neurobiology crash course. Third is something more about culture, less about the internal workings of just one person or just one task, and more about those who were around. Breakout room discussions were part of the original design. We'll probably skip that and just take any questions and discussion that there are within the group. So first is a paper I want everybody to read. So there's a QR code here. I didn't check it today. It was active as of the last time I checked it last fall, but this should go. Otherwise, the reference will be true. With this paper, physician distress and burnout, neurobiological perspective, was far and away the most readable reference that there was on this for me. And the range that we had there's a lot of kind of lay press stuff. When I was looking for some references, we're working on a clinical practice guideline for the Wilderness Medical Society about this and similar issues of workplace burnout and operational stress injury. So looking for kind of references there were a lot of kind of paperback books and sort of a "you got this, girl" kind of vision of things, and then guys about how to not get burned out in the hustle economy and these kind of things. And so if you just kind of looked for burnout, you would find it. People would want to talk about it, but it wasn't really geared towards both our concerns as clinicians and our knowledge base as clinicians. And I don't know if you guys are like I am, but the first time I saw a therapist, he told me I had to stop bringing notes and flowcharts in. He banned that from me. And so if you also lend yourself to kind of an intellectualization kind of end of things, this is really helpful just to have it described in the terms that we're used to seeing, and the way that we're used to thinking about problems and others, to be able to see it laid out in that way. Within that paper, there's the original case definition of burnout. So this was defined basically simultaneously within a couple of months of each other by two different people in the psychology field. One was in New York and one was in San Francisco. The San Francisco psychologist, her boyfriend was, strangely enough, the PI in the Stanford prison study. I don't know if any of you are familiar with that, but pretty dark. So that was her boo. And then on the New York side, I think it was a psychiatrist or a psychologist who was, aside from his usual mental health post, he was also working in a city or county kind of health office that was chronically understaffed, chronically overworked, chronically dealing with a clientele who lacked the resources to look after their own health care, and trying to engage in benefit structures and other things that they really didn't have any agency over. But everybody was overworked. Everybody was in a situation where they wanted to advocate, but had very little power to do so, and definitely no power to change those structures or those sort of benefit structures for their clients. And so the the New York paper that came out, I believe it was 1976, was the one that's the most frequently kind of cited as defining burnout. And in the first line of that, burnout refers to an occupational syndrome. And this is the definition that's currently used by the World Health Organization, is what's here on the slide. And it was that occupational syndrome kind of defined by being in that space, and with those different influences kind of as your inputs, how do you turn out? So it's basically, it's a behavioral phenotype of how you get when you're subjected to these different stressors. I think everybody can read this and kind of see those initial stages, and then the physical illness risks that you take on after being subjected to this sort of emotional milieu for a while. Basically, think cortisol. If you always have cortisol in your system because you're always pretty stressed, it's kind of like taking prednisone every day. And so these people start to resemble one another. You think about the classic sort of late career beat cop who's got a big belly and has a heart attack while he's out there. That's your truncal obesity. That's your poor stress modulation. That is the risk of early onset cardiovascular disease. And then moving on forward, a key aspect of this here in the last portion, it is precipitated by characteristics of the work environment rather than by individual problems or problems with the individual. And so this last year was interesting to me in one way, and now having had my private group start publishing large required modules on the on burnout, and seeing the tilt of what's presented by employers versus what's known from the academic side, I think it's an interesting juxtaposition too that we'll get to. So this is basically the case definition. East and West Coast definitions mostly the same, and the one that's referenced the most is going to be from your East Coast. East Coast said late 70s. So neurobiology course here for the burned out brain. So you've got a couple of different centers that are going to be most at play here. First is going to be your medial prefrontal cortex, and that is the seat within your brain where, if there was a driver's seat where you sit when you're awake and that you feel like you're in control, this is where that location would be. Part of the neocortex, and this is where on functional MRI, you will have things like your personality, your core values, your problem solving. This is where you're doing arithmetic in public. This is why that is so distressing. The elements of yourself that really make you, and when you can tell yourself apart from other people in the way that you would solve a problem or the way that you would engage with someone culturally. These aspects of self are really housed in the medial prefrontal cortex. Also, that optimism, persistence, and self-talk is an interesting thing that's here. Your ability to self-govern as a volitional activity, metacognition, and your ability to steer your thoughts and to observe oneself and try to make deliberate decisions about what to do next are all sort of housed here. The function in this area is based on, it's mainly an acetylcholine kind of area. So that tracks with caffeine, that tracks with nicotine, and the things that kind of get your filter back or kind of shake off the cobwebs kind of feeling. Those are usually elements that will regain you a little bit of acetylcholine, sort of higher functioning kind of stuff. So this is essentially the driver's seat of your brain. And this is where we want to spend most of our time, especially when we're working clinically. If you're trying to learn clinically as a trainee, if you're trying to present things to one another, like I'm trying to present to you now, this is where I want to be residing. And if you're trying to engage meaningfully with a patient and make a connection, project your best self, the way you see yourself and the way that you've been trained to put yourself out there, this is where all that's getting constructed and where it's all being put out forward. So the effects of arousal state on prefrontal cortex function, you've probably seen diagrams like this before, where if you have very low arousal, you're bored, nothing much is being demanded of you. That would be in the bottom left of this diagram. As more is being expected and you have increasing arousal, there may be a state of fatigue, but you would be able to alert yourself to a position at the top. It's also referred to as eustress, E-U-S-T-R-E-S-S, eustress, being kind of a true stress, one in which you have your demands of your environment are matched with your ability to meet those demands. It conjures from you an amount of energy that is both something that you can meet, and with training that you have where you can meet that moment, that's considered eustress. And then as you go further off to the right side, you get further arousal, but no greater ability to meet that arousal, no greater ability to meet that task. And so then you start to fall off and move towards severe stress. And so there should be, in order for you to get the most from your brain, there does need to be a load put on. You do need to have some demands. There's a sweet spot for that. And then once you go too far, then things just get worse and worse. Now, part of that drift off to the, as you're moving from the left side of this diagram towards alertness, some of that has to do with the increasing activity in your prefrontal cortex. Now, as that continues, you should be able to just maintain your same level of prefrontal cortex activity as more and more is being put on you, unless there's something else too that might be dragging that down, that's pulling you out of that driver's seat and taking you out of your best self as those stresses are becoming more poignant. That's where we get to the amygdala. The amygdala is part of that downward pull in your performance that happens as your stress load gets too high, starts to be beyond what you really have the capacity to handle. Then a state of panic can start to set in. The amygdala is the part of your brain that triggers that sense of panic. Once you get, it's that feeling of sort of being out of your depth. If you've been in a room with a patient who's crashing kind of up to a point, you feel okay, and then at some point you're like, this one's not for me. I need a grown-up. I need somebody here to help manage this. The amygdala is that thing that has been fired off and given you that sense that this is out of my control. I'm not doing well. I need backup. It's a good thing to have. You got to have it to take care of yourself, to take care of loved ones, to take care of other people. This is a necessary function. However, it's also what starts to inhibit our function as stressors get greater. The name of that phenomenon is cortical inhibition, and the amygdala is a part of your brain that does that pulls you out of your thinking self, that pulls you out of your culturally grounded self, that denies you access to the memories of the way you were taught to act when this thing happens. The amygdala is what takes all that away, snuffs it out, and puts you into your lizard brain, and it has all your protective reflexes in it. So senses danger, and it's constantly on guard. This is when we're awake. It's constantly filtering the sounds that are coming in. Right now where I'm sitting, I have cicadas all around me, but if I heard an owl or something else here that didn't belong, it would be that brain center that's always filtering things like sound, things that we see, smell. They give you that little tickle, that sort of Malcolm Gladwell sort of twitch in your mind that something's not right here. And even when you're asleep, it happens too. There's a salience center that's hooked to the amygdala, that if you play for somebody in a functional MRI machine, if you play a new mother, the sound of a baby crying, she gets one signal on the fMRI. If you play her a signal of her baby crying, she gets a different signal on the fMRI, where there's a salience signal where a part of your brain is always awake and always looking, always trying to find things that matter, trying to filter out threats from the rest. This is that part. So the sensitivity to various stimuli is learned and trained over your lifetime of experiences. And so there are things that you could see on a monitor now, regardless of your level of training, that wouldn't have worried you, say, if you were a high schooler shadowing in that same room, because you didn't know what to make of it. You wouldn't know if it was important. But now you know, if that looks like that, and that looks like that, this one's over here, that pattern is now disturbing to you, and you'll see it, and you'll recognize it. So these things can be trained, which is kind of good, but they're hard to untrain, which is kind of bad as well. And so the way this interacts with burnout is it can train this system to be on basically a hair trigger that ejects you from your driver's seat, that denies you access to your higher levels of cortical function, denies you your cultural knowledge, denies you your book learning, denies you a systematic approach to things, and just takes you into a much simpler and perhaps less professional kind of mindset. So then we can sum up these two aspects of the neurobiology with kind of an alert and top-down control paradigm on the left, and then on the right there's the fatigue and stress with a weak prefrontal cortex function and weak top-down control. I'll let you kind of look through and compare and contrast those areas on the bottom. But basically, the one on the left is your early in the morning, not yet stressed, had your coffee, best self, maybe you had a jog, you're good, nothing is really taking you off your game yet. The one on the right is your fatigued, distracted, annoyed one where you're more likely to fire off a chippy comment than you would have been otherwise. And these figures are from the paper in the aforementioned reference. And this video.
4th floor, short stay unit. Where's your secret hospital bathroom? Dude, I'm not telling you. That would defeat the purpose of the... Oh my God. Is that Bill? Yeah, I think it is. Hey, Bill, you doing okay, buddy? He's not looking too good. Wait a second, what's this? Oh, man. What is it? It's Bill's post-rounds to-do list. There's like 50 items. And none of them are checked off. Oh, God. Is he sick? I don't know. He didn't do his discharge summaries. He didn't consult PTOT on any of these patients. All right, we got to get him some help. Go find a doctor who's good at diagnosing things. Okay. How about him? Ortho? Come on, man. Okay. How about him? An ophthalmologist without a scribe? That's worse than ortho. Wait a second. Bingo. Family medicine. Can you help? I don't know what's wrong with him. Oh, what? You mean Bill? Hey, he's got burnout. What? Burnout? Oh, yeah, I know that look. Yeah, Bill feels helpless and defeated in a system that doesn't value him or his well-being. Wait, are you sure? Yeah, you see his eyes? You see how empty they are? Yeah, that's burnout. Yeah. But why isn't he moving? Oh, yeah, with end-stage burnout, your muscles stop working. Why? Because it takes literally every ounce of energy you have left just to keep breathing. What do we do? Yeah, you gotta hit that button. I'm the CEO. How's he doing? Not good. I got you, Bill. Don't you quit your job on me. Oh, hello. I didn't see you there. I was just reading this book on success. You look a little burned out. I've got just the thing. A warm blanket, a hot cup of tea, and a 10-part workshop on resiliency. Over the next 2 weeks, you'll learn how you and you alone.
So I love the way that ended because of the emphasis on you and you alone. And so then talking about the organizational aspects of this as well, there are individual aspects, just like the CEO there from Glock and Flecken Hospital wanted to put out, but there are organizational features as well. And if you think back to the original case definition of this being an occupational syndrome, a lot about what we do is based on our task that we do, but then a lot of it has to do with where we work and the environment where we're delivering this care. And so organizational features that were defined as contributory, both with the early and with the later literature on this, are kind of laid out here. So the foundational thing here that has to do with all the case definitions is uncontrollable stress. This has to do as well. It has some similar strains with PTSD in individual traumas that people sustain. Uncontrollability and the sense of a loss of control is a big deal, and makes things more difficult to reconcile. Makes more significant long-term injuries than if you feel that you're in control of your situation as it's unfolding. This sort of uncontrollable stress within an organization can resemble a lot of the things that you are probably subject to right now, I would guess, as trainees. You're somewhat invisible depending on where you are. And you can be in academic institutions that kind of have a culture of doing more with less. And so a lot of these things are probably aspects that you'll be familiar with. If you're not being directly exposed to now, then you may be soon. And I love the experimental condition that they've used to create this is just with constant noise. They'll do this with rats, they'll do it with other mammals, and they'll just turn on some noise that you just cannot stop. And that's the no sense of irony aspect here too, that if you're in any of our clinical spaces, a lot of the time you'll just have dinging alarms and things that I don't even turn around for them anymore. I just don't. No matter how loud it is, no matter what direction it's coming from, I just wait to see if somebody says words at the end of it of, hey, we need you in room 3, then I'll go. But there is no single sound. There's no robotic alarm that I stand up for anymore in my workspace. And there were some studies that put the number of those alarms that go off up to 1 million per month in an ICU setting. So uncontrollable noise, uncontrollable stress. These are features just kind of the everyday, regardless of your organization. And your organization can create more of them for you as well. So the original sort of breakout room discussions here, I'm going to instead kind of break up as topics for discussion. I'm going to mute myself, and I would really love to hear from you guys. Kind of what are the things that you're seeing here? That neurobiology about sort of control and access to your best self. What have you seen by specialty or by training environment, by West Coast versus the East Coast? You got a lot of differences here. How you observe this kind of gain and loss of control in others and for yourself. Your organizations, has this been brought up for you in different ways that either kind of had purchase or really didn't? And then the aspects of kind of mutual support that you can have here as well. I think the sort of peers moaning back and forth to each other, I think there's a really healthy thing about that, to be able to kind of discuss the warts of an organization without sort of getting down in the weeds and being kind of defeated by it. Can create some camaraderie, but can also at some point become toxic. Go easy on each other. And then is there anything that you have seen done that you think was really helpful? I can share some stories from myself of things that I've changed about my own work patterns and things since last summer doing this. But first, I'd like to hear of any ways that you all have kind of felt that brink, walked back from it, adjusted your relationship with your work, adjusted to the relationship with your organizations, and been able to redirect a little bit. So with that, I would very much like to mute myself and just be in listen mode here for a little bit to hear your thoughts and about what's about your experience so far as trainers.
I can speak a little bit to this just as a first year PA school student, I guess, Kurt. I feel like probably 2 months in, I had to make a big shift in the amount of little things that I cared about. So like not being so nitpicky and knowing when to just let something go was huge, because I was finding myself very overwhelmed with just the like number of little things that would pile up on my plate. So I mean, just like recognizing that it was a thing, being involved in a group that kind of reinforced that was super helpful. Like reinforced, hey, we're not in competition mode, we're in like build each other up mode, was very helpful just within our school and our faculty. But yeah, that was just like little things that don't matter, let them go. That was big for me.
Anybody who kind of hears some camaraderie with that, I would encourage you to look at a couple of things. One is the notion of time confetti, which is, I think, just a beautiful term for what happens throughout our day, where how seldom it is that we do the same thing deliberately for 10 minutes at a time without stopping. Our phones are breaking up our attention, our emails breaking up our attention, just the number of things that are out there will just kind of carve up your day into all these teeny weeny pieces that are good for keeping your fingers on a gajillion different things, but they're terrible for building meaningful relationships or meaningful work. Substance and meaning are part of the cultural aspects that can be protective against burnout, and they're impossible to cultivate when your day is a just endless string of 5-second snippets where you really don't get to do anything that resembles the other end of that spectrum that's been popularized kind of in the lay press is deep work, where you really sit down without distractions, invest your mind in something, take something in, put something out, and have kind of the opposite of that time confetti kind of feeling. But thank you. Yeah, thank you for that. I think there are a ton of things about our work environment now that really lend themselves to the experience that you had. And most things are little things, but it's hard to tell the difference a lot of the time. And moreover, you're not given agency to make that determination for yourself, because you're getting all these tiny little things like driven down your throat as an early trainee. Learning how to filter those, you gain both more judgment and more power to filter those as you go. And so I hope that, well, that was my experience, and I hope that you have the same one.
Sorry, my dog's barking. Something that came to mind as you were speaking earlier, and I'm a student right now as well, so I'm not experiencing it as much right now, but being in a former management position where you have a lot of responsibility, but very little decision-making ability, was for me a huge recipe for burnout, and trying to affect some kind of organizational change to break that cycle was really, really difficult. Ultimately, I left that position because I just had to for my own mental health. But I know that this is not a new problem. It's not unique to that specific organization. So I'm just curious if you have any thoughts on that.
I do, yeah. So that's a phenomenon that is specifically named and discouraged within military culture, is one of having responsibility without authority. You never want to be that person who is responsible for something, but you are not invested also with the power to control the outcomes. Oh my gosh, you guys are all at such terrible risk for that. I really regret having to bring that up right now, but it's yeah, that is something that I think once you see that, you can't unsee it, and once you felt it, you recognize it. and it's something that probably all of you will be subjected to. You'll get a glimpse of at least, even if it's not put out in a deliberately or systematically abusive kind of fashion. I would encourage you to just think of it in those terms, just jot that down. And the next time you think you're going crazy at work, just look at that little note on your fridge. Just say, am I being held accountable? Do I have responsibility for something that I do not have the authority to control? And that's something that you can then start to pick apart. But it's a complicated feeling, but one that does have a name. And so and one that you guys are standing squarely in the path of at every level of training and practice.
Wow, Dr. Eifling, can you hear me? Because this is something which exactly happened to me in the military, and I had to choose to. I volunteered for a different position because I didn't have the authority while I had responsibility.
We can hear you, Vishay.
Yeah, and I don't think it's something that the military is immune to. I think I learned it there and no place else because it happens a lot there, and there's a lot of very specific delineation of those roles there, and so I think it's culturally easier to see, easier to name, and easier to reject within that environment. And I think there's a lot more softness within civilian culture about whose job is it to do this and who's going to hang for it if it's not right. And so I think it's easier to see in the military because everyone's job is written down neatly on paper, and there's just more accountability for those things. You can always in a better position to fix it though. But I don't think it's a coincidence that both of us learned that phenomenon within a military structure.
I think with what you were talking about with the burnout and coping with it and recognizing it, for me, I was working as a paramedic before going to PA school. And it was, particularly when I was picking up way more hours than I probably should have been because we were short during COVID too, and so I ended up coming home, and it was like you're talking about with the lizard brain, where I was, but I was just never recovering. I was going to sleep and I was working in my sleep. My dreams were about work. And so I would go to work and I would work and I would come home and I would work in my sleep and then I would go to work again. And I recognized, that I was a lot more irritable and I was never feeling rested. And the way that I handled that was I stepped out of it and I went on a camping trip with my dad because like you said, I needed to be away from my cell phone. I needed to be away from technology. I needed to be away from things that beeped or, I needed to just not be needed by anybody else for just a little bit. And I think that was the most therapeutic, healthy thing that I could have done in that instance. And I saw a lot of coworkers who didn't take some kind of time for themselves, not necessarily camping, but just some time to set aside doing something that was just for them. And the burnout was so much higher.
Yeah. And that'll, so that ties in with kind of the way burnout was presented in my annual modules this year for Team Health, a relatively large and evil conglomerate of physician employment out of Knoxville. I think they employ more physicians than anybody in the country at this point. They are owned by a private equity firm, BlackRock. And so we are, of all the physicians who can be kind of like a number on a page, oh man, we are them, right? But we're also, we're the trauma center in our town, and we take care of a lot of people who need us, and some of us have been there for 20 years. And so from a client facing standpoint and from a care space standpoint, nobody knows. And we're a pretty stable group. We're pretty happy all together. The training that we had this year really sort of dove into the idea that our our clinical work, and it was kind of across all specialties. It was internal medicine, anesthesia, emergency medicine, all these different things. And it really dove into the idea that your work as a clinician is emotional hazmat. This is a radioactive experience that you're having, and there's a dose that you can withstand, and there's a dose that you can process in a day, and there's a dose that you cannot process in a day. And if you're over that, it's just going to keep piling up a little bit by little bit each day until it ruins you in some unforeseeable way. And I thought that was really interesting because I did those modules maybe 2 months ago, and I had put together this talk for the first time last summer. And so thinking about it, I have, well, there are these tasks, and even, with that original case definition group, their task was burdensome and it was awful, but they were also victims of their superstructure. Their organizational structure rendered them powerless about it. And so I think for my group, teaching us about the dangers of our activity, about our clinical work, I think there's something to that. I do think that there's more emotional hazard in being somebody's emergency room doctor than there is in being their barista. There is a penalty and there is a hazard that comes with our work, kind of regardless of your care space. But there was a complete just shut down and really no engagement with the organizational side. For those training modules that may be offered to you by employers, what I found was that ours really ignored, in their employee facing materials, they really didn't do anything. And maybe it was different for the middle managers and for the uppers, where they talk about this stuff kind of in its more full spectrum. But they're trying to get us to acknowledge and kind of understand that I need to take time off. They encourage taking time away, getting vacations. Here's how we'll help you get a therapist. Here's how we'll do these different things for you. But really not highlighting so much the aspects of organizational culture that can serve as a multiplier, basically, for the experiences that you're having. And another example, that I can think of is if I was in the grocery store and somebody said, "Hey, I need you to clean the bathroom real quick. Would you mind doing that?" I would kind of have a problem with that. But if I was at my kid's preschool and someone said, "Excuse me, Kurt, we really need you to clean the bathroom. I'll tell you about it later," I'd say, "Yeah, where's the mom?" Being in an organization where you feel like you have some purchase and you feel like it matters and you feel like the people are there for you and you're there for them, takes that same task. It's like, yeah, I'll do that all day for you guys, but I don't really want to do it necessarily, in this other place. And it's not just about industry. Because the little Sicilian grocery that we used to go to in St. Louis, if those guys asked me to come and mop the bathroom, I was like, yeah, for sure. You got a jug of Chianti next to the sandwich counter. Like, you guys are geniuses. I'll gladly do this. And so it has to do with context. It has to do with your traction and sort of purchase within that organization and how much you really want to be a part of that. So I would encourage you to think about both sides of that. And so I think for the experience that you had with your paramedic work, some of it's about the task and some of it's about the day in and day out. That can be alleviated, I think, by cultural aspects, or it can really be worsened by cultural aspects. And so those will be different for everyone and kind of different depending on the context. But you can think about those things differently, and they may not be presented to you differently in your training moving forward in organizations. But I would encourage you to if you're going to take one thing from this talk, it's that you may not be introduced with those ideas of organizational control later on, and that notion of you and only you have the power over your burnout that's antithetical to the idea. Okay. Well, I'm glad to hang out here for a little while longer if anybody wants to hang around and chat, but I will hand this back over to our facilitators to wind up in whatever way they want, and I'll plan to linger. Thank you all for your help and for your time.
That was awesome. Thank you. Go ahead, Amy.
I was going to say the same, Mary. And then if anyone has any questions for Kurt in these next few minutes, feel free to come off mute, or you can throw them in the chat and we can address them as a group. Thanks, Kurt. Really appreciate your time.